Good afternoon. About 2 weeks ago, I read a note to you all from a single mother who worked at a factory farm here in Iowa. She came here as a refugee after surviving war in Burma. She has lupus and was worried about getting sick because she felt her work environment was not safe. Last night, I found out that she has tested positive for the virus and is now hospitalized. My thoughts are with her, her family, and all other Iowans who have been so profoundly impacted by this disease. Opening up these press briefings on Mondays is quite challenging as we've grown accustomed to many events transpiring over the weekend. While the number of confirmed cases from around the state and our region continue to grow, the same is true for Linn County. And in addition, we have seen more positive cases in staff and clients at both long-term care facilities and group homes. This should serve as a reminder to us all that our work is not done. And while we have learned today that a majority of Iowa counties are being effectively reopened, we must still show respect for those individuals who are seriously ill, for those who are working with the seriously ill, and for the families who are impacted and have lost loved ones. We do this by being responsible with how we readjust to the changing directives from Governor Reynolds. Now, I want to be clear. Linn County was not included in the group of 77 counties that are set to be reopened with some restrictions. But we do border 4 counties that will be reopened. And we've developed a graphic that I can point out exactly what's happening with the reopening. So if you look at this graphic, you'll see we're here in Linn County, and directly north, Buchanan and Delaware counties are counties that are going to be slowly reopened. And to the east and southeast, we have Jones and Cedar County. But we all know here in Iowa, many people travel from, let's say, Jones to Linn County, perhaps to work or to drop into town to pick up the essentials. The same would be true for folks in Cedar County traveling to Johnson County, and obviously folks in Buchanan County traveling to Black Hawk County. The point is, we are a region, and opening up some counties around us may still have an impact on us here in Linn County and other counties that may be affected by this. While I only have information that was gleaned from the governor's press conference a few hours ago, I can tell you that this new approach to reopening our economy at such great speed can only work if we remain vigilant and apparently remain within the borders of our own counties as much as possible. However, Linn County is a major hub for our region, and hundreds, maybe thousands of residents in surrounding counties likely work and travel here for the essentials. When I said earlier that we need to show respect for everyone still actively engaged in this fight, I mean we all need to continue operating as if every person we come into contact with is carrying the virus, even if that person lives in a county that has been given the green light to reopen. We must remain vigilant even as the weather changes and it gets nicer out. We must remain vigilant even as our region was downgraded from a 10 to a 9 because our data shows that confirmed cases continue to rise, and we've had more outbreaks at long-term care facilities, meatpacking plants, processing facilities, and group homes throughout the region. When I presented to you last Thursday, the number of confirmed cases in Linn County was just over the 500 mark. We have since added more than 100 names to that tally. And to my mind's eye, we haven't gotten a good handle on this thing just yet. So I implore all of you to keep this in mind as we move forward. Be careful out there in all that you do. The desire for a full return to normal is palpable. The chorus of voices of some public officials urging a full return seems to grow stronger every day. I get it. But if we are not careful in how we do this, we could easily end up back to where we are now. Right now, the needs of our economy are seemingly at odds with the demands of our public health system. Our challenge is figuring out how we reconcile this conflict, but it should go without saying, Our economy only works when there is a healthy workforce to power it. We do need to move forward, but we need to do so intelligently and safely. Thank you.
Good afternoon. Tony Myers, Mercy Medical Center, Vice President of Medical Affairs. I'm going to start by just giving an update at the hospital at Mercy. We have at this point a relatively stable pattern of between 8 and 14 people in the intensive care unit on any given day. We have 3 to 6 people on ventilators, and a similar additional number every day, 8 to 14, are in the hospital for reasons that could be COVID, and so the tests aren't back yet. And we've kind of been in this pattern for the last 2.5 weeks. One slight concern, and Supervisor Walker, I would echo that it's really, I can understand the urge. We all want to get out and we all want to get back, but we've had a slight increase over the last 4 days of admissions at the hospital, and it makes me concerned that could increase and worsen, and so we just need to continue again. We've got to wash our hands. We've got to mask when we're out. We've got to, stay home if we're sick, and try to maintain that social distancing. And so I need to read a statement here real quick. And I think there'll probably be some questions about this. Certainly in the medical community, there's lots of questions about this. Iowa Governor Kim Reynolds announced last week that health systems may begin working to resume some elective surgeries and procedures. Mercy Medical Center, Unity Point Health, Cedar Rapids, Physicians Clinic of Iowa, and Linn County anesthesiologists do not yet have a definitive timeline to share with the community. But we can tell you that we are in the planning process and resuming elective procedures. We're planning. We know this information is of great interest and importance to those wanting to move forward with their health care. A lot of people have been putting off things for weeks, some of them that really need to be done, and so we're certainly working in that direction. Now, as we have throughout this crisis, the medical community continues to work closely together. It's important to note that our planning is and always has been driven by guiding principles that prioritize the health and safety of our team members, patients, and communities. As we consider restoring elective surgeries, we're looking at several criteria, such as the hospital's continued capacity to care for critically ill patients, which we know will continue for some time. Supply of personal protective equipment, pharmaceutical supplies, available blood supply, and the establishment of pre-surgical processes and procedures, which will be different because of COVID. A stabilized trend of COVID-19 cases in the community and availability of testing are also important considerations. As community health care providers, we are looking at all of these factors jointly to determine how best to proceed in a way that keeps patients, healthcare workers, and the community safe. As we formulate and firm up these plans, we'll continue to keep the community updated on timelines and other information related to the return of elective procedures. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 1 p.m. today, there are currently 625 cases of COVID-19 in Linn County. There have been 35 deaths, and 324 individuals have recovered. Over the weekend, an additional outbreak at a long-term care facility was announced. St. Luke's Living Center West in Cedar Rapids is experiencing an outbreak of COVID-19. At this time, 43 residents and staff have tested positive. There are no deaths associated with this outbreak. We continue to track all long-term care facilities within Linn County for signs of illness. If long-term care facilities meet the state's definition of an outbreak, they will be listed on the state's website, and we will provide updates. We continue to follow up with outbreaks that were previously reported at Linn County long-term care facilities. At Heritage Specialty Care, 110 staff and residents have tested positive. 24 of those residents have died, and 73 staff and residents have recovered. At Linn Manor, 22 staff and residents have tested positive, 4 of those have recovered, and 5 residents have died. At Manor Care Health Services in Cedar Rapids, 13 residents and staff have tested positive for COVID-19. There are no deaths associated with this outbreak. Additionally, as released in a statement from 4 Oaks over the weekend, the organization is also experiencing cases of COVID-19. We are working closely with the facility to provide guidance, testing, and personal protective equipment. In order to protect the privacy of the residents and the staff, we are not able to release any additional information. We are receiving many questions about testing. Anyone that feels ill needs to call their healthcare provider. The decision for testing is a decision between the patient and the provider. We are not recommending testing for individuals that are not ill due to the limited supply of personal protective equipment. Additionally, we have received many questions about serology testing to identify if a person is immune to COVID-19. At this time, there is no scientific evidence to support that having antibodies to COVID-19 equals immunity. Additionally, if someone were to be immune, we do not know how long that immunity would last. Employers should not be requesting employees to have antibody testing to return to work or to determine job duties. Antibody testing is important to understand the amount of infection within our community. Many researchers are working to better understand if individuals that have had COVID-19 will have immunity. However, we need to remember that this is a new virus, and we are still learning about it. Finally, if you have questions regarding testing with Test Iowa, please visit the Test Iowa website or contact the governor's office at 515-281-5211. Today, the governor announced plans to begin the process of relaxing social distancing measures in place. In Linn County, this will tentatively begin on May 15th. We want to remind you of the importance of continuing social distancing measures, staying home when sick, covering your cough, washing your hands often, and using cloth face coverings when in public, when social distancing is difficult. If we do not continue these measures, we will see an increase in cases. This may lead to a burden on our healthcare infrastructure due to an increased number of hospitalizations and, unfortunately, more deaths. This relaxation of measures is not a call to return to the way things were before COVID-19. We all need to do our part to protect ourselves, our families, and each other. This marathon continues. Thank you.
This is the end of the prepared remarks for today. We do have time for a few questions. Our first question comes from Michaela Ram at the Gazette. And for media attending remotely, just a reminder to indicate to the moderator if you would like to be entered in the queue. And a reminder to our speakers to please repeat the question prior to answering. Michaela, go ahead with your question, please.
Hi, I have a question for Heather. Heather, I wondered if there had been any word if the strike teams that were sent to Tama County to test more in long-term care facility employees, if anything like that may be coming to Linn County.
Thank you for your question, Michaela. So Michaela Ram from the Gazette is asking about the strike teams that have been placed in facilities such as long-term care facilities in Tama County, if there's any plan for those strike teams to come here to Linn County. And the answer to that would be no, not at this time. At this time, Linn County has the resources and the personnel to be able to do our own testing and our own follow-up investigations. So we will not be utilizing those strike teams at this point in time. You know, we're always open to reassessment of that, but no, at this time we will not be asking or requesting any strike teams to come into Linn County.
Okay, and to follow up on something you said earlier, Heather, about you don't recommend testing for anyone who is not ill just based on the supply. So that would apply then for employees of long-term care facilities. It's not your recommendation to test employees to ensure that an outbreak doesn't occur or doesn't spread any further?
Okay. So thank you, Michaela. So Michaela's question is about testing employees at long-term care facilities. And Michaela, for that question, it really depends on what's happening at that facility. If that facility has healthy residents and healthy staff members, no, we would not suggest testing staff members to look for COVID-19. However, like I've said before, we are monitoring all long-term care facilities on a daily basis. If we start to see anything that would look a concern to us, if we started to see a positive case among the staff, among the residents, we would look at the number of staff employed, the number of residents that are there. We would talk to staff members. We would ask if there are other signs of respiratory illness. And so in some situations, we will go ahead and test everyone within that facility because we may be worried about COVID-19 being shared within that facility. So never say never. If we are worried about COVID-19 within a long-term care facility, knowing that that's where we've had a greater burden of disease, yes, we may go ahead and make that decision to go ahead and test individuals that are asymptomatic, which means that they do not have symptoms.
Okay, thank you.
Okay, thank you.
Our next question comes from Isabella Zaleska at Little Village. Isabella, go ahead with your question.
Yeah, my question is for Supervisor Walker. I was wondering if the county, or if you could talk about anything happening at the city level, if there are additional locations where people experiencing homelessness can stay. I saw that the Board of Supervisors today extended the overflow shelter, but I was wondering if there's additional locations for individuals.
Thank you for the question. The question was, are there additional locations for individuals experiencing homelessness in our community? As you pointed out, the Board of Supervisors has been in close communication with organizations like Willis Dady. We've also been talking to Waypoint and a few other organizations to assess their capacity and where they're at, and we try to relay and refer information accordingly. We also have entered into a partnership with Willis Dady, the City of Cedar Rapids, to purchase hotel rooms for individuals who are experiencing homelessness who may need to be quarantined. So to remove them from sort of a general population of where the homeless may be sheltered at this point. I would refer anybody interested in these services to either contact the shelters directly or to contact 211, and they can be put in touch with organizations that can answer any specific questions about where what kind of space exists at our shelters here in the community. And they can also contact the Board of Supervisors, and we'll do our best to track down that information.
Okay, thank you.
This next question is from Beth Malicki at KCRG. Beth texted her question to me, so she's not on the line, so I will read that. This question is for Heather. Heather, how many contact tracers have been added to your team since the pandemic began? How many people are doing this work?
Beth, thank you for the question about contact tracing. So we have been continually adding individuals to help with contact tracing. We have used some health department staff that work in other areas within our department to help with contact tracing. We have also worked with the Cedar Rapids Medical Education Foundation for medical residents to come in to help with contact tracing. We have some school nurses that are not working right now that have come in to volunteer their time for contact tracing. We also have students from the University of Iowa College of Public Health that are in the master's program that have come over to help with contact tracing. So at any time, we may have anywhere up to 15 people trying to work with us, not trying, but they are working with us on contact tracing. So it really fluctuates a little bit day by day. We have not had any issues with our contact tracing or trying to stay on top of that at this point. And we are looking at some other options to increase that capacity even more if the need were to arise. So right now we have more than enough individuals to help with contact tracing. I hope that answers your question.
The next question comes from Ashley Neighbor. Ashley, go ahead with your question. Do we know if Ashley was going to chat in her question possibly?
Hi, can you hear me?
Oh, hi Ashley, go ahead.
Okay, perfect. Thank you. This question is for Heather. Last weekend, I know you said that you were investigating, or Linn County Public Health was investigating a possible outbreak at group home facilities. This weekend, Four Oaks did release that they had an employee who tested positive. And I just wanted to be clear about the language that you used. You said that Four Oaks is experiencing cases of COVID-19. Is it accurate to say that there is an outbreak happening in the facilities? And then the second part to my question would be, I know that you consider an outbreak to be 3 residents or more. Are you counting just one facility when you're looking at considering an outbreak, or are you looking at all of their facilities combined? Because I know they have several locations.
So Ashley, thank you for your question. She's asking about the classification of an outbreak at facilities. So I think it's important to remember that a lot of times when we're talking about facilities, we're really focusing on nursing homes with long-term care facilities. Nursing homes have a little bit of a different guidance that comes as compared to other facilities. And so at times we're not able to release information unless it's necessary for the protection of the public. And so we want to remind everybody that due to community spread, right now everyone needs to practice those 3 C's. Cleaning your hands often, covering your cough, containing yourself at home, to practice social distancing, wearing that cloth facial mask when you can't do social distancing. Right now there's not a threat to the public from any of the group homes that we've worked with. So when we're doing an investigation, it's an investigation. Something has come up, we're trying to figure out what's going on, so we're looking into it. That investigation may yield that there's nothing going on, that this is just normal respiratory illnesses that we see commonly at this time of year, or it may reveal that we had COVID-19. So that's what an investigation is. So we may be doing an investigation, but we don't have anything definite to tell you at that point in time. When we find something, if we're able to tell you that, we will, but there are some different rules that govern group homes compared to nursing homes and those type of facilities. And so we're able to give you as much as we can. At Four Oaks, they've released their statement that they have cases of COVID-19, and we really can't say anything more than that. We do not have permission from Four Oaks to release any additional information. So if you are a parent and you have a child that's at Four Oaks and you're concerned, we would strongly encourage you, reach out. They want to talk to you and they want to communicate with you and let you know what's going on at Four Oaks. If you don't, we want to remind you that there's community spread within Linn County. You should be concerned, as Supervisor Walker said, with every interaction that you have that could be potentially COVID-19, but there is no threat of COVID-19 to the public, to the community, from any of our group homes. Does that help to answer your question, Ashley?
Yes, thank you.
Okay, thank you.
Looks like that is the end of our questions for today. So it will conclude our press conference. Our next press conference is scheduled for Thursday, April 30th at 3:30 p.m. I just would like to remind everyone watching that we have been holding regular virtual town halls on topics relevant to COVID-19. And the topic for the town hall this Friday will be providing information on personal finance, employment, and legal aid. And details will be posted soon on the Linn County webpage and social media accounts. We do encourage our residents to participate. In summary, Linn County's following metrics are 625 cases, 35 deaths, and 324 individuals have recovered. Please continue to practice physical distancing, stay home when you're sick, and wash your hands. Thank you.